what's the deal with this mutation in the coronavirus? In England, they just figured out that there's a new mutation that makes it maybe a little bit more infectious and maybe up to 70%. But the real question is, now that we have these vaccines, is the vaccine still going to work? And the answer is yes, it's very likely to work and it won't be an issue. And I'll tell you why. Everyone has seen that picture of the coronavirus. You have that big ball with the red spikes on it, and that spike protein is what the vaccine makes your body produce so that you get antibodies to the spike protein. If you get antibodies to the spike protein, then your immune system can respond when you get a real infection and go after that spike protein. Now, if there's a little mutation in it, then it really doesn't make a huge difference. And I'll give you an analogy. Say if you have a car that's driving on the highway, right? And you have a lot of cars there, and one car is a bad actor, causing a lot of problems. It's like running into walls, other cars, etc. And you have a highway patrolman kind of looking to see, what cars they should go after. They're going to go after that car, right? To keep it from causing problems. And the car is kind of like the coronavirus. The policeman is kind of like the antibody. Now, say you take a piece of that car, like the fender, and change it out. That's kind of like having a different piece of that spike protein in that coronavirus. That's a mutation. You change out the fender, but you know what? That coronavirus or that car is still causing a lot of problems. It's running into stuff, and it doesn't matter what that little fender looks like. It's just a little piece of that coronavirus or a little piece of that spike protein. That police officer or your antibody will still go after that car or that virus that is behaving badly. So that's why a small change in that coronavirus really won't make much of a difference with the vaccine. And that's why the vaccine is very likely to work. Until next time, thanks. Stay safe.